Depression is a common but serious illness. When you have depression, it interferes with daily life and causes pain for both you and those who care about you. But now there is a new treatment, a device that has been effective without the use of medications. Psychiatrist Dr. Manish Sheth discusses the benefits of this new TMS therapy for depression.
TMS therapy is the latest non-invasive FDA-approved treatment for depression. It uses a magnetic coil to stimulate the part of the brain that is responsible for depression, mood symptoms, and executive functioning. TMS uses the technology of an MRI machine where it uses a magnetic coil where it sends magnetic pulses into the prefrontal and the frontal part of the brain, which is then connected to the other parts of the brain and thereby changes the chemistry and the electrical conduction of the neurons or the nerve cells. A good candidate for TMS is someone who has tried different classes of medications for treatment, who have been compliant with the medications but either has side effects to them, or the medications did not work, or if they worked, they were not fully effective.
I heard about TMS through counseling in my last bout of depression about 3 years ago. I had a 6-week session where it was Monday through Friday, about 40 minutes a day. And within 2 days, I noticed that I was sleeping better, that my focus was starting to come back, and I think it was either on the second or third day, I walked outside. I looked out and noticed the sunlight. My marriage is better, my relationships with people are better, and that's all based on the foundation of TMS.
My husband went first, and I saw such a remarkable difference after the first session that I tried it and it worked out well.
Dr. Sheth compares TMS therapy to other treatment options for depression.
When you or I take medication, that medication has to go through our gut, our intestine, has to circulate through the rest of our body before it reaches brain. So it causes a lot of side effects. Whereas this treatment, the TMS, is directly applied over that part of the brain which we know is responsible for mood regulation, and thus it avoids all the systemic or the body side effects. Treatment of depression is measured in terms of response and remission. A response means that a patient feels difference in terms of their symptoms, whereas a remission means that they feel that their symptoms are more than 50% controlled for a prolonged period of time. With this treatment, almost 70% of the people get a response, which is almost twice as much as we see with the medications. And about 35% of the people get remission, which is again very significantly higher than most of the medication on a prolonged basis.
Dr. Sheth examines what a patient should expect when having a TMS treatment.
TMS is a very unique treatment. You come in, you drive in yourself, you come for the treatment for about 25 to 35 minutes. You are awake, alert, you are discussing with your doctor or your therapist about your treatment goals, your treatment planning, and then after the treatment, you actually drive back to work or home. So it is very convenient, very comfortable. All you can expect is some feeling of tapping on the scalp, on that part of the head where the treatment is to be given. TMS treatment is covered by most of the commercial insurance companies.
I've been suffering from depression and anxiety for most of my life. My moods were up and down, even with the meds. They're constantly up and down. And so when I heard about TMS and talked to a few people that had it done, they said it worked wonders. So I said, I'll try it. I recommend it to anybody that's been suffering from depression, that hasn't been able to find the right meds, or that just can't get relief from depression or anxiety, in my case the anxiety, and the sleep. I would highly recommend it.
Depression can be dangerous for some people if left untreated.
This is another medical condition where a person can feel suicidal, where if it is untreated, sometimes they even act on those thoughts. So it is very critical that the loved ones who are around this individual, they are able to give a feedback, or they are able to talk to their doctors about the symptoms before the treatment, during the treatment, and after the treatment. This is so unique because we are able to directly access the parts of the brain that can fix depression without having to not only not write the medication, but also see a quick response, and a response which is sustained for 15, 20, 25 weeks. So that is just phenomenal.
This therapy is being investigated for use with other conditions.
There is a significant amount of research and clinical trials going on right now in our country to see if this can be used for conditions like PTSD, nicotine dependence, and really hard to treat obsessive compulsive disorder or OCD.